think getting to this point, my oldest daughter, was a great basketball player, and in high school she tore her ACL, needed surgery. So we were in Houston. I spoke to the surgeon who is the lead knee surgeon for all the Houston sports teams, the Astros, the Oilers, the Rockets. But he was telling me and during the exam, he's got pictures on his walls of all the famous athletes he's operated on, and they did this person's knee, et cetera. And I looked at him and I said, Jim, I have one question for you. On Monday, I need one good operation. I don't care how many you've done in the past, how many great athletes you've done, but can you give me one good operation on Monday? Because that's what I need for my daughter.
Yeah.
He looked at me and said, no one's ever asked me that question before.
Right.
I said, well, I'm asking you today.
Yeah.
He says, yeah, I can do it.
Yeah.
But that kind of changed my perspective, because now whenever I do a heart catheterization on a child, a baby, a newborn, an older child, even sometimes, as you said, a fetus, and the most precious thing in that family's life is their child.
Yeah.
And they're trusting me to put these catheters in their heart and do balloons and crazy things. And I just found myself now, after I asked the surgeon that, I have to be more prepared. Now, I can't have a bad day.
Right.
You have to have your A game every day.
Yeah.
And I think when you have that perspective, it just teaches you a new set of responsibility and what you owe it to these families. And just applying that now as chief medical officer is really just, these patients are here because they're vulnerable, they're ill, and they're trusting us with their most valuable possessions. Mm-hmm. And the least we can do is give them our best.
Yeah. Well, I think what your question, I'm really taken with that, because you were a patient and advocating for your child and your daughter at that point. Was she in high school at the time?
Right, yes. Mm-hmm.
So, that having just the courage to challenge this,
famous
world-renowned, famous athletic surgeon to say, I don't give a shit about all these posters on the wall. I need one from you.
Exactly.
And I'm sure you would recognize that same intensity and sort of concern from a patient or their family at the same time. And just one little story. I mentioned to you that Dr. Foodie, who was a famous neurosurgeon in Michigan here, with Spectrum Health at the time. But anyway, I remember specifically, sort of half joking, when he took Faith, our youngest daughter, off for another brain surgery. Sure. And I just joked, it's like, Dr. Foodie, I don't want to put any extra pressure on you today. You got your hands full, but this one means a lot to us. And, but just that little probe, little fun, it was something that relieved my pressure. I don't know if he took it. He certainly, sort of smiled and laughed, and I think he appreciated it, because it kind of snaps you into this moment, because I think there's so many procedures and so many patients you see, there's a blur. But I think what you're talking about with this particular surgeon in Houston, you really related one-on-one, and that got him thinking about your daughter's case specifically, at least for a moment, to calibrate.
Well, it did, and it got me thinking after that, every patient I take care of. I'd never really had that perspective before. Yeah. But if this was so important to me that we get a great operation, every patient I see, it's their parent, they have the same perspective. It's important for them, for me to do a great procedure, and it just really kind of upped my game. I owe it to them to really make sure we're continuously doing everything we can to do the best for these patients, and not just for the patient, but then discussing it and educating the family what we did, where we are, and where we will be going. And if you can, as I said, if you can answer, nothing's more important for me when at the end of a discussion with a family, any question, they say, no, you've answered them all.
Yeah, right.
Then you've connected, and they're going to have a comfort level with you, and they'll feel that their child is great cared for.
The Full Exposure Podcast is brought to you by Metro Health, University of Michigan Health, and Dr. Peter Hahn, in appreciation of the creative and artistic visionaries who enrich our lives through cultural connections.